Hello. Hi guys. Can someone just type something in the chat or just unmute if you can hear me and see me clearly?
We can hear you.
Oh, perfect. Thank you. Thanks, Helen. First of all, I just want to say really sorry for the delay. My power cut in the entire building, so about 20 minutes before I was meant to start the lecture. So unfortunately, we've had to postpone, but thank you so much for joining. I'm going to go through, as you know, I'm going to go through the entire respiratory system anatomy. The goal is to give you guys a good overview of everything. I'm going to try and go into as much detail as I can without overwhelming you too much. And then at the end, I'm really happy to take any questions. So if you have any questions in mind, just throw them in the chat, and I will look at them at the end, or otherwise you can just ask me at the end. Yeah, and then we'll basically just wrap up. I aim to wrap up in about an hour, so hopefully shouldn't take too long. Okay, so let's get started. So yeah, as you guys know, I'm doing respiratory system. My name is Deelan Vadher, and this is my first lecture of this semester for MIMSA. So the format is going to be as follows. So I'm going to just quickly, briefly go through some of the learning outcomes. What I hope you guys can take from this lecture after today, and then we're going to dive into the respiratory system. So I've divided it up into two parts: so upper respiratory tract and lower respiratory tract. So from the upper respiratory tract, we have the nasal cavity, and then we have the paranasal sinuses. And then from the lower respiratory tract, we have pretty much everything else. So beyond the paranasal sinuses, we have first the larynx, then the trachea, then the bronchi, lungs, pleura. And then I'll kind of conclude there with, and I'll ask you guys if you can fill out a bit of feedback. So jump straight in. So learning outcomes, first of all, I'm just going to explain things to you based on what is recommended by the Department of Anatomy. So I've taken all these information from the White Book. So that's the anatomy of the splanchnology and angiology White Book. So if you haven't got that already, I'd recommend you go and get it. I'm sure you've been told by everyone to go and get that book. So I've taken all the information from there, and all of the images are referenced in the very last slide, and I've taken them from my MIMSA Anatomy Atlas, the 6th edition. Yeah, when it comes to studying and trying to explain anatomy, the first thing you need to try and do is you need to just do kind of a scope of the system you're about to study. So try and understand the structures first. Try and understand where these structures are located before you go into any detail. You learn any components, any foramina, any arteries, vessels, any veins. Arteries, veins, nerves, any muscles, details. Basically, just try and understand where the organ is and what the basic functions are. Then you add on a bit of information, which is position and syncope. So you'll see I've written P/S a few times in this PowerPoint. So this is position syncope. This is something which is really important to try and understand. And they'll try and test your knowledge in this in the final exam. So what is position syncope? Position syncope, as you guys know, because you've already been through the digestive system, is the relationship of the organ or structure to other neighboring structures. And the topography of the respiratory organs in general. I'll go through. So anatomical pictures I've included here, like I said, from Netter's Atlas. I'd really recommend you study from a White Book and the Atlas, just generally. It doesn't matter which atlas it is. My personal preference is Netter's. A lot of people use Sabota. It just depends on what you prefer. The reason I like Netter's, and this is something which I tell students quite often, the reason I like Netter's, or I prefer Netter's to Sabota, is when it comes to the thorax and the abdomen. Netter's is really great in showing you a nice full-page A4 image of the entire region of the body, and you can see all the organs in relation to each other, whereas Sabota doesn't do this as well, I think, in my opinion. But Sabota is good for isolated structures like a temporal bone, or, for example. But definitely pick an atlas and stick to it, and you'll benefit from that when you study the material alongside, because you'll start to make these relations in your head. You'll start to visualize the images that you see. And then just to kind of wrap up, I want to just the way I like to present is the way or the way I teach is the way I tutor or explain things. It's pretty much how I would answer the oral question if I was doing the exam. So it's the way you should try and structure your answer basically in the summer exam, which you'll have. And the last part is try and have some fun, because every student I talk to explain, you guys are going through a bit of change in the curriculum at the moment. You have these USMLE style tests. It's a lot of it's a lot of knowledge, basically, a lot of information you have to try and absorb and digest. So I think the most important thing is anatomy is a foundation for pretty much every other subject going forward and your career, after graduation. So try and take it all seriously, spend as much time as you can, obviously, but it is interesting, it is fun, and I hope you guys enjoy it anyway. Okay, so let's start with the nasal cavity. So basics of the nasal cavity. So first of all, functions. So these are the functions of the nasal cavity, or in general. So major functions are obviously it's a respiratory organ, conducts the air into the lungs through the various pathways, and it's an olfactory organ as well. So olfaction, you'll learn this in a bit more detail in a few weeks' time when you cover the cranial nerves, but the olfactory system is responsible for detecting smell. Humidification of air and also production of speech also functions. So this image here is here to show you, hopefully you can see the cursor on the screen. So you can see how I've got P/S. P/S, as I said before, is position centipede. So what's the position in the centipede of the nasal cavity? Well, first of all, to understand the centipede, you need to understand where the nasal cavity is. So just be very clear that the nasal cavity is divided up into a few different parts. And it's actually this space inside the skull. So you're looking into the nasal cavity. The nasal cavity is not the external structure. That's the nasal vestibule. So what is it bordered by? It's bordered by the frontal bone here, the orbital structures here, the buccal structures here, and the oral below. And you can describe this region topographically by talking about topographical anatomical direction. So laterally, what do we have? Superiorly, posteriorly, inferiorly. I think this makes a lot of sense. So just to briefly go through nasal cavity. Superiorly, we have the anterior cranial fossa. So this is if we remove the frontal bone in this region, we would find the anterior cranial fossa. Laterally, we have the ethmoid air cells, which we can't see here, but we have the maxillary sinus over here and ethmoid air cells. Posteriorly, so behind, we have the nasopharynx. So the continuation of the nasal cavity is into the nasopharynx. Nasopharynx is the first, or is also one of the portions of the pharynx. As you know, you have nasopharynx, oropharynx, laryngopharynx. So a bit of recap there. And then inferiorly, we have the oral cavity, so located just underneath. So a bit more detail now into the parts. So we have the external nose, which is what you can see. So this is the external nose with obviously the skin removed and the muscles and vessels. Everything has been removed. All we can see here are bones, and we can see cartilage, and we can see a little bit of fatty tissue just to show you how the structure of the external nose is formed. So the most important things to understand here are the different types of cartilage we have. So we can see we have septal cartilage, which are these large triangular shaped plates here. Okay, we have lateral cartilages, and we have major and minor alar cartilages, and some variable accessory cartilages as well. So these are the main names you need to try and understand. This is a view from caudally looking upwards, looking rostrally. And it's important to know that the external nose is made up of the bony part, which is the nasal bone from either side, so a paired bone, the cartilaginous portions, which are these cartilages we've just mentioned, some fatty tissue, and then obviously overlying skin and subcutaneous tissue, subcutaneous fat. So that's the cartilaginous portion. The nasal vestibule is the space. The vestibule itself is the space inside. So it's so we have the nostrils, which are the opening into the vestibule. So all of this space, which has been delimited by the cartilaginous portion, is known as the nasal vestibule. And the nasal cavity proper is what we looked at in the previous slide. So this is the cavity which projects into the skull, and this is divided up divided in the midline by the nasal septum. Okay, so let's go into a bit more detail about the nasal cavity proper. So the nasal cavity proper is divided up into two halves, like I said, by the septum, and each half is divided up into spaces. And there are these spaces called meatai, or singular is meatus. And the spaces themselves are divided by solid protuberances into, or projections into the towards the midline, basically from the lateral wall towards the midline, and these are called conchae. So we can notice, I'll show you an image in a second. Yeah, so we can see three nasal conchae. So we have a superior nasal concus, or concha, middle nasal concha, and an inferior nasal concha. So what we're looking at here is a mid-sagittal section through the skull, and we can see these three conchae quite nicely here. Now, one thing I want to mention here is if you look at your white book, you'll see that there is a scheme for this. It's not this view. It's you're looking sort of anteriorly. You're looking at the anterior side of the nasal cavity, looking into the nasal cavity, basically, and you can see both halves of the nasal cavity proper quite nicely. And just in case nobody's told you before, just in case you haven't heard, you need to be able to reproduce and draw all of the schemes in the splanchnology book for your final exam. It's always a good idea to be able to draw these basic schemes. Okay, so back to the slide. So I mentioned we have these three conchae, then we have these spaces. The spaces are located above or below or next to the conchae. So the space which is located above the middle nasal concha is called the superior nasal meatus, and this extends posteriorly as what's called the sphenoethmoid recess. Okay, so the sphenoethmoid recess is behind here. Then we have the middle nasal meatus. Again, remember this is the space I'm talking about, and this middle nasal meatus is located below, or inferiorly to the middle nasal concha. And you're probably wondering, why do we need to know these spaces? Why do we have these spaces? The spaces are important to know because we have various sinuses or cells draining into these areas, these regions. Okay, so what drains into the superior nasal meatus? The sphenoid sinus and the posterior ethmoid air cells. Middle nasal meatus, the maxillary sinus, frontal sinus, and anterior ethmoid cells drain here. And they drain through these two very small structures, which I'll show you in the next image. So I won't mention them right now. Then we have the inferior nasal meatus. And the inferior nasal meatus, as you can see, is a very small space, which is located inferiorly to the inferior nasal concha. And here we can find lacrimal secretion being drained via what's called the nasolacrimal duct. Okay, then we have what's called the common nasal meatus. So we can't see it here, but it's this entire space here. It's difficult to visualize, but if you see your scheme, you'll see the common nasal meatus. And the way to describe it is you can just say it's the narrow space between the medial borders of the conchae and the nasal septum. Just remember from this view that we're seeing here, we can't see the nasal septum. Nasal septum has been removed, and we're looking behind the nasal septum in this mid-sagittal thing. And then we have the nasopharyngeal meatus. This is a space between the posterior ends of the conchae and the choanae. So what's the choanae? So choanae or choanae is here, this space over here. And again, it's difficult to appreciate where this space is, but if we imagine sort of a passage, we enter the nasal cavity through the nostrils here, then we enter into this space, which is, as we mentioned before, the nasal vestibule. We carry on even more posteriorly, we come to the nasal cavity proper, and then the nasal cavity proper terminates here. This is what's called the choana. This is just an open space. If we continue past the choana, we leave the nasal cavity and we enter into this space. This is called the nasopharynx. So the choana is the space which divides the nasal cavity anteriorly and the nasopharynx posteriorly. Okay, and then the next image I want to just show you is this one. So this is basically a slightly deeper dissection. So what we've done here is we've removed the conchae. Okay. So by removing the concave, so if I just go back a slide very quickly, just pay attention to the differences between the slides. I'm going to go back a slide now. This is with the concave intact, and then we remove the concave, and we can now clearly see the openings we mentioned before. So these are the structures I just want to quickly talk about, okay, because I mentioned what drains into the middle nasal meatus. Quick recap, it's the maxillary sinus, frontal sinus, and anterior ethmoidal cells. You do need to know what drains into each meatus, okay? And these sinuses and cells drain here via these two structures. So we have what's called the ethmoid infundibulum and the semilunar hiatus. So we can see these shapes here. Semilunar, this is this structure here, is this half moon shape. Yeah, this is the ethmoid infundibulum. And I mentioned the nasolacrimal duct, which opens into the inferior nasal meatus, which you can see quite nicely here. Okay. So nasal septum. This is the part which divides up the two halves of the nasal cavity, and it's made up of different things, different substances, materials, we could say. So there's a membranous part, there's a cartilaginous part, and there's an osseous part. So the membranous part is located between the nostrils, and this is just formed by connective tissue, okay? So membranous, there's no cartilage, there's no osseous part. It's just purely subcutaneous tissue, fat. Cartilaginous part. This is the part, this is the cartilage of the nasal septum, and also, and this is a recap from the previous slide where we talked about the cartilages, also the medial crura of the major alar cartilages, okay? So this is the major alar cartilage here, and this is specifically the medial crura or medial crus, singular. And this is the nasal septum, or the septal cartilage, sorry, I mentioned. Okay, and you can also see we have these other colored bones, and these colored bones form the osseous part. Okay, so we have this lilac colored bone, which is the perpendicular lamina of the ethmoid bone, and then we have this green bone, which is the vomer. Okay, so all of these components, all of these parts make up the nasal septum. So once again, we have a membranous part, we have a cartilaginous part, and we have an osseous part. So now let's quickly talk about just wrap up and talk about the mucosa and the neurovasculature. One thing which you will probably not need to know right now, but it's going to be essential, it'll earn you some points if you can answer this in your histology classes, is to know a type of epithelium. So the nasal cavity has two different types of epithelium. We have what's called respiratory epithelium and olfactory epithelium. So very quickly, respiratory epithelium is this specific type. Okay, it's called pseudostratified ciliated columnar epithelium. You'll see this in the book. This is just talking about the morphological type of the cells which line the majority of the respiratory cavity. There is a small section, however, of the mucosa which is called olfactory epithelium, and this is located in the roof of the nasal cavity, the superior nasal concha, and the adjacent part of the septum. So there's a very small area, and this is obviously specialized tissue. We find olfactory nerve endings here, and this is where smell is detected. Yeah, our sense of smell comes from. But you'll learn this more when you study the cranial nerves. Okay, so mucosa, so that was the mucosa, then the neurovasculature. So you'll see at every part of this book, this splanchnology book, at the end of every organ system, you'll see a little section on arteries, veins, lymph, and nerves. Now I've included here just for completion, but, and obviously this works differently for different people, but I actually, when I first studied this section of the book, or this book rather, I didn't pay any attention to this section, this last area where it talks about the neurovasculature. I thought it was quite confusing. Instead, what I did is I tried to learn the systems quite well, learn the structures very well. And then once I finished cardiovascular system, which is one of the last chapters in the book, then I went back and I studied all of the arteries as a whole. Then I did all of the veins, all of the lymph, and then the nerves you will study in detail when you do the cranial nerves. So just for completion now, we have the sphenopalatine artery, ethmoidal arteries, and I've just put in brackets here where they come from. So for example, and I'm not going to talk about too much detail here, but for example, the sphenopalatine artery originates from the maxillary artery, which is one of the branches, one of the terminal branches of the external carotid artery. So ECA, external carotid artery, ICA means internal carotid artery. CN, V1, V2. This is a Roman numeral V, so this is actually the fifth cranial nerve, which you'll study in a few weeks' time. This is the trigeminal nerve. And this should be a small number, sorry about that. But V1 indicates this is the first branch of the trigeminal nerve, also called the ophthalmic nerve, and V2 is the second branch, which is also called the maxillary nerve. So you'll study this in detail, and I don't want to go into it in too much depth right now, just in case you haven't studied it, and I don't want to confuse you. But I will send this PowerPoint to the preclinical team, and hopefully they can put it on the drive, so you can access this recording anytime you want to on YouTube, and you can access this PowerPoint with this information I got from the white books, also from the MIMSA Hub. And these images are just there to show you for your own self-study where these neurovasculature structures are located. The veins image hasn't been included here, but the veins follow the arteries very similarly, so don't worry too much about the veins. As long as you understand where the arteries are, you should be fine. Okay, let's move on to the paranasal sinuses. So paranasal sinuses, what are they? In terms of the functions, and I'll talk about the actual ones we have. So they lighten the skull, they assist in production of sound, so sound resonance, and they also supposedly produce some nitric oxide. So which sinuses do we have? Okay, so first of all, we have the maxillary sinus, then we have the frontal sinus, ethmoid sinus. Ethmoid sinus you may see referred to as ethmoid cells. So we have anterior and posterior cells, but I'm calling it a sinus here just so everything's called a sinus, and sphenoid sinus. Okay, where are they found? Okay, so where exactly are these sinuses? These sinuses are hollow cavities. These are large sort of porous or hollow cavities in the skull at different locations. So maxillary sinus is located here, and you'll remember we talked about the drainage of all of these sinuses. The sinuses are lined with their own mucosa, and they produce fluid. The fluid will drain into or through the passages, the relevant passages, into the nasal cavity, and they will drain either into the superior, middle, or inferior nasal meatus. I was going to talk about a bit detail, go into detail about each type, but I'm just going to give you a few points from each one, the most important things to remember. So for each of these, you'll note in the book talks about topography. So it talks about what is located medially, superiorly, laterally, inferiorly, etc. to each sinus. So it's just an overview. Don't worry too much about that information now. I'm just going to recap some of the important things, like I said. So first of all, maxillary sinus. Maxillary sinus opens into the ethmoid infundibulum and the semilunar hiatus into the middle nasal meatus. Okay. The frontal sinus is you can't see the frontal sinus in this scheme. I apologize. Maybe in the next one. Yeah. So frontal sinus you can see here, which is located in the frontal bone, in the squama. It's called the squama frontalis, behind this this protrusion, which is called the glabella. And it's divided into asymmetric halves by a septum. There's a septum inside it. And this frontal sinus will open through the frontonasal duct into, again, ethmoid infundibulum and the semilunar hiatus. So that also opens into middle nasal meatus. Ethmoid sinus, or ethmoid air cells, we can divide up into two parts. We have anterior and posterior ethmoid air cells. These are 3 to 18 hollow structures in the body of the ethmoid bone. And the anterior cells, like before, drain into the ethmoid infundibulum, into the middle nasal meatus. However, the posterior cells have a different route. Now, they drain into the superior nasal meatus. And finally, we have the sphenoid sinus. So the sphenoid sinus is located here in the body of the sphenoid bone. And the sphenoid sinus will drain into, again, the superior nasal meatus. Okay. So what's important to know from the sinuses? Functions, which ones we have, where they're located, and then a bit of detail about each one. So obviously I've mentioned an overview, but to give you a bit more detail or like a template of what to say. So, pick a sinus, explain what is located either side of it, above, below, for example, give all the anatomical directions. talk about the drainage, where it drains, and then talk about the blood supply and innervation. Okay, so let's move on to the larynx. Okay, so larynx is a tricky structure for a lot of students because it's quite complex, but I think it can be broken down quite nicely. So let's start off with the structure and function. So it's composed of three main portions. So I'm going to discuss these in turn, and I'm going to try and be as easy to understand as possible. So cartilages, joints, muscles. Okay, so when you study the larynx, study them in that order. So study the cartilages first, then you'll learn how the cartilages are connected to each other. So these are the joints. And then finally, you'll learn the muscles which move the cartilages in the joint, okay? And as you know, the larynx is there for voice creation. So position centipede. As you can see from this image, it's located, well, actually, you can't see from this image, apologies, but the larynx is located in adults at the level of C4 to C6. In children, it's located C2 to C4. In terms of its continuation, where it starts rather, the laryngopharynx transitions into the larynx, and then the caudal continuation is into the trachea from C6 onwards. The thyroid gland is located in front with the thyroid isthmus in front and the thyroid lobes laterally. We also have the common carotid artery, internal jugular vein, and the vagus nerve located laterally either side. And a small bulge posteriorly is called the hypopharynx. Okay. In terms of, oh yeah, sorry, I forgot about this image. This is just showing exactly what I've just mentioned. So you can see the relationship, the position syncope of the gland and the neurovasculature quite nicely here. Okay. So let's dive into the cartilages. So first of all, I'm going to just mention what the names are, and then I'll talk about a little bit of detail for each one. So thyroid cartilage first, cricoid cartilage, arytenoid cartilages, there are two, epiglottis, unpaired, singular, and then we have corniculate and cuneiform cartilages. So again, these are paired, very small cartilages. So this is the scheme which kind of shows you everything you need to know. So thyroid cartilage first is the largest cartilage making up the larynx. There are two laminae. These laminae are the flat surfaces. And you can see quite nicely from the image, there's a very deep upper notch or superior notch or incisure and a shallow lower notch. Okay, there's two horns on the posterior border superiorly and two horns on the posterior border oriented inferiorly or caudally. Cricoid cartilage. This is a ring-shaped ring-shaped structure with the lamina which is oriented on the posterior side. So you can see this is the cricoid cartilage. You can see here, sorry, just to be clear, this is the cricoid cartilage, this ring. And this is the anterior side. You know, the anterior side has the arch. This is the arch of the cricoid cartilage. And this large flat surface or structure or part of the cartilage is known as the lamina, which is located posteriorly. What you can see, or what you should really pay attention to here, is the relationship between the cricoid, first of all, and the thyroid. So again, this is the thyroid cartilage here. This is the anterior side of the ventral side with a deep superior incisure notch. And we can see the relationship between the cricoid cartilage here. So the inferior horns of the thyroid cartilage, either side, articulate with the cricoid cartilage. But we'll come to this in a moment. Now looking at the cricoid cartilage, we can see these structures located here. These are located on the superior border of the lamina. This is actually two cartilages. Firstly, we have the pyramid-shaped arytenoid cartilages, and then on top of the arytenoids, we find the corniculate cartilages. Okay, so a bit of detail now with the arytenoid cartilages. So you can see quite nicely it's a pyramid-shaped cartilage. You can see here again the different surfaces, and they're paired. They have two extensions and they have three surfaces. Okay, once again, they have two extensions and three surfaces. So what does that mean? There is an anterior extension, which you can see here, and this is known as the vocal process. And this is the attachment of the vocal cord. Then we have the dorsolateral extension, which is also known as the muscular process. And this is the site for muscular attachments or insertions. There are three surfaces. So we have what's called the anterolateral surface here. we have the medial surface here, and we have the dorsal surface, or the posterior surface. A little bit of detail. Anterolateral surface, which is this one here, is actually divided up into two components, two parts. And they're divided up by this line. This is what's called the arcuate line, or crista arcuata. And this divides it up into the fossa triangularis, or triangular fossa here on the superior portion, which is for laryngeal glands. And then we have the caudally located fossa oblonga. Why do I mention this? Well, the fossa oblonga is the site of insertion of one of the laryngeal muscles, which we'll come to. The muscle itself is called the thyroarytenoid muscle. Then we have the epiglottis. Epiglottis is this leaf-shaped structure, which I'm sure you're all familiar with, composed of a stalk and a lamina. And then we have these two small cartilages. So we can't see both of them, but we can see the corniculate cartilages. Corniculate cartilage is located on the apex of the arytenoid cartilages, and the cuneiform we'll see, I think, in the next slide. Okay. Now, in terms of the joints, there's a few different joints we have. So hopefully you've studied the general arthrology, so you're familiar with terms syndesmosis, synarthrosis, etc. So I won't go into detail here, but you'll see that we have both types here. So we have synovial joints here, and we also have our synarthrosis, so our ligamentous joints, so syndesmosis to be specific. So these are our joints. So I'm going to talk about them with the picture in a moment. So cricoarytenoid, and just one thing I wanted to mention, I've actually hyphenated these joints to make it easier for you to understand. The reason I've hyphenated them is because it makes learning them so much easier, yeah? Because you can see very clearly what two cartilages are involved, what two parts of the cartilage are involved. Okay, so cricoarytenoid joint, this allows for rotation and sliding movement, okay? So cricoarytenoid joint, this is the same image we saw before. So between the cricoid and the arytenoid. And this creates abduction or adduction of the vocal cords. So it's basically the joint surface here between the cricoid cartilage and the arytenoid cartilage. So you'll see all the Latin terms in the book. For example, it will say if we're talking about this joint specifically, I won't go into all the detail, but for all the joints, but just for this joint specifically, the book will talk about the arytenoid surface of the cricoid cartilage. So it's a surface on the cricoid cartilage which articulates with the arytenoid cartilage. Okay, that's just a nomenclature. It's how the book describes the joints by talking about the surfaces. And there is a posterior cricoarytenoid ligament which reinforces this joint. Okay, and essentially what this does is it allows the arytenoid cartilage to move, to slide along the this axis, this transverse axis. So it creates abduction or adduction, so AB or adduction of the vocal cords. Then we have the cricothyroid joint. Cricothyroid joint is located between the cricoid cartilage here and the thyroid cartilage, so we can see it quite nicely here. This is the cricothyroid joint, and as you can possibly tell, this moves the thyroid joint. The thyroid cartilage tilts it forward or backwards, so oscillatory movements. Then we go into the membrane. So this is the thyrohyoid membrane. So this is classified as a joint or a syndesmotic joint. And as you can tell from the name very nicely, as you know, from the images, the larynx or the thyroid membrane hangs off the hyoid bone. So this simply just connects the inferior or the caudal border of the hyoid bone with the superior border of the thyroid cartilage. And then we have a few more ligaments. So hyoepiglottic, thyroepiglottic, so between the hyoid bone and the epiglottis, or between the thyroid cartilage and the epiglottis. And these function to stabilize the epiglottis as it moves forwards and backwards, basically, for swallowing. Now, fibroelastic membrane. Fibroelastic membrane, it's a little bit tricky to see on here, but it's actually composed of two main components. We have the quadrangular membrane, and we have the conus elasticus. So quadrangular membrane, and it's not, yeah, sorry, this is not actually easy to see on this, but I'll try and mention this in a later slide. But there are two components. Quadrangular membrane essentially hangs in the midline, hangs down, and it terminates somewhere here. And it terminates in what are called the vestibular folds, or the false vocal cords. The conus elasticus, in contrast, is the ligamentous structure which is located here. And the conus elasticus terminates cranially in the vocal cords. So you can see the vocal cords here, the vocal ligament in the vocal cord here. And then finally, the cricotracheal ligament is between the cricoid cartilage and the first tracheal cartilage. So the cricotracheal ligament. Okay, so we talked about cartilages, then we talked about the joints, which allow different types of movement. And now we're going to talk about how they actually move, so the muscles themselves. Okay, I'm not going to go through origins, insertions, functions, innervations for every single one of these muscles. I think it's a bit pointless. What I will do is I will point out where these muscles are located, and I will talk about the different classes of muscles. So the book divides them up quite nicely into three groups. So number one are the epiglottic muscles. This is the two muscles which move the epiglottis. Okay, the epiglottis can only move, or has two movements. It can either move forwards and upwards, or it can move downwards through the swallowing process. Second group is the muscles which move the arytenoid cartilages. Okay, so the arytenoid cartilages, these pyramidal shaped structures, can move, and they can move in two different axes. So they can either move away from each other or towards each other. This is the sliding movement. So if we look at the image, we can see the arytenoid cartilages are located here. This is a superior view, so we're looking down into the throat, and this is what we see. So this is anterior, this is posterior. So arytenoid cartilage is located here, and they can move laterally or medially, or they can actually rotate. So there is a rotatory movement. So if they rotate or slide, you can see or you can imagine what would happen to the muscles. The muscles, or in this case, the vocal cords, would move closer together, which is called adduction, or they will move away from each other, which is called abduction, abduction. So there are four muscles which do that. And then we have a couple of muscles which will alter the tension of the vocal cords. So tension of the vocal cords, as we know, is responsible for creating the pitch, or sorry, not the pitch, the pitch of the voice. So deep, lower pitch, or higher pitch. And this is achieved by two muscles, cricothyroid and thyroarytenoid. Another thing I want to mention is when it comes to innervation, all of these muscles, with the exception of one, are innervated by the recurrent laryngeal nerve. The recurrent laryngeal nerve is a branch of the vagus nerve, so cranial nerve number 10. And the exception, which is a very useful one to remember, exception is the cricothyroid muscle. So this is the cricothyroid muscle. So connecting the cricoid cartilage to the thyroid cartilage. And we can see the cricothyroid muscle here. Okay. Just in case you're wondering, or if you can't imagine it, the action or the function of the cricothyroid as it starts on the cricoid and originates in the cricoid, inserts into the inner border of the thyroid, as you can see here as well, is the cricothyroid. As it does this, it pulls the thyroid cartilage down, and it tilts it, and it creates tension of the vocal cords. Okay. This is another image, which shows you, again, the movements of the oscillatory, the sliding and rotatory movements, and how the vocal cords move. And two other things I want to mention, because there is a scheme for this in the book, is that when you look down into when you look at this view of the larynx, you'll see that there is a respiratory position and a phonatory position. So this would be the respiratory position when the vocal cords are wide apart, far apart, so it allows for breathing, respiration, and as the vocal cords move together, the space between them is narrowed, and this is the phonatory position. So when you're talking, the vocal cords are located closer towards each other. When we need to breathe, so respiratory position, they are abducted. Very simply, that's just a scheme which is in the white book. Okay. In terms of the parts now, and just to wrap things up with the larynx, neurovasculature, this is a scheme which shows the mucosa. Okay, so this is a frontal section, and we can see the three parts of the laryngeal cavity. So it's described as a sand glass or sand-shaped timer in frontal section. So we have the vestibule first, yeah, and this is the epiglottis. This is the thyroid cartilage here, cricoid cartilage here, the first tracheal cartilage, second tracheal cartilage. So this is the epiglottis once again, and you can see the structures I mentioned previously. So I mentioned when we talked about, actually I'm just going to go back so it's easy, I should have incorporated this before. Yeah, so this is the fibroelastic membrane. So we have the quadrangular membrane and the conus elasticus. Just remember those. Quadrangular membrane, conus elasticus. So now moving forward. So this quadrangular membrane is located here. And you can see it terminates caudally in the vestibular folds. Whereas the conus elasticus is located here. It's ligamentous structure. And it's described here. And this terminates cranially as the vocal folds, or vocal cords are located in the vocal folds. Okay, so these are the two. This is the fibroelastic membrane, which is it's embedded in the mucosa. So it's not easy to see from the previous images, which removed the mucosa and just made it possible to see the bony and cartilaginous structures. Okay, so the different parts: vestibule. Then we have the glottis. This is the glottis. The glottis is located between the vestibular folds and the vocal folds. Once again, vestibular folds and the vocal folds. This narrow space is the glottis. In children or in infants, they have this laryngeal saccule, which is the superior extension of the glottis. And then finally, we have the infraglottic cavity, which is everything below, basically, up until the trachea. So up until the inferior caudal border of the cricoid cartilage is the infraglottic cavity. Okay. In terms of neurovasculature, again, I said before I wouldn't go into too much detail, but just so you know, these are the main structures you need to understand. Superior inferior laryngeal nerves are quite important. We mentioned innervation of the muscles is everything is innervated by the vagus nerve, the 10th cranial nerve. The cricothyroid is innervated by the superior laryngeal nerve, in contrast with every other muscle, which is innervated by the recurrent laryngeal nerve. Okay. But just important to mention, you know, if you have this question in the exam, you need to mention all the structures you can see here. They will expect you to have a good understanding of what's located nearby, but don't worry too much. When you study the vessels, especially the external carotid artery, you'll learn all these things quite nicely. Just a note, SA is an abbreviation for subclavian artery. So this means the subclavian artery gives off the thyrocervical trunk, and from the thyrocervical trunk, we have the inferior thyroid artery coming off, which gives off the inferior laryngeal artery. So it's just a sequence, basically. Okay, now let's move on to the trachea. So trachea is essentially continuation of the larynx, like I said. It's superficially covered by the infrahyoid muscles in the cervical portion, and in the thoracic portion it's a bit more complicated. So cervical portion first, as you can see here, this is the image which I showed you before, covered by infrahyoid muscles, thyroid gland, common carotid artery, internal jugular vein, vagus nerve laterally, which are in the so-called paratracheal space. What's located behind the trachea? Well, we find the esophagus. Okay, esophagus is located behind, and in between the larynx and the esophagus, we find the recurrent laryngeal nerve. Okay, now thoracic part. In the thoracic part, things you need to say are that the trachea is located in the superior mediastinum. The brachiocephalic trunk, inferior thyroid veins are located anteriorly. So these are all things you can see in this scheme. Aortic arch and the left recurrent laryngeal nerves on the left. Yeah, remember aortic arch is, well, actually you haven't studied this yet, so I'll just tell you. Aortic arch comes off comes from the heart and basically turns posteriorly and to the left. So it's located on the left side. On the right-hand side of the trachea, we can find the superior vena cava. Both sides, bilaterally, we find paratracheal lymph nodes. We find tracheobronchial nodes around the bifurcation, and again, the esophagus behind. So for the trachea and the lungs, I will talk a little bit more detail. I will talk about the lymph nodes in a little bit more detail, just because you need to know the groups and where the groups of lymph nodes are located. So let's talk about the structure and the neurovasculature. So first of all, structure. As you can see from this nice image, we have about 15 to 20 horseshoe-shaped cartilages. So for those of you who don't know, this is what a horseshoe shape looks like. It's a C, sort of C ring. And this is the ventral anterior side. This is the posterior side. Why is this important? It's important because posterior side is not covered by cartilage. Yeah, you can see the cartilage stops here. So there's no hyaline cartilage here. There is just what's called the membranous part, the membranous wall. This is just mucosa and smooth muscle. The trachea continues from the extension from the larynx, like I mentioned, all the way up until this point. This is located roughly at the level of T4, the fourth thoracic vertebra. This is where we find the bifurcation. Okay, and the bifurcation crest. So what do I mean by crest? I mean this actual area here. This is located. This is what's called the carina of the bifurcation. Okay, so now in terms of the neurovasculature, so arterial supply, I think it's quite straightforward. Nerves, you'll notice that we have sympathetic and parasympathetic fibers. So again, don't worry too much because you'll study this towards the end of the semester. But the autonomic nervous system dictates innervates all the organs. And we divide the autonomic nervous system up into sympathetic and parasympathetic. So sympathetic comes from the upper or superior thoracic ganglia, and parasympathetic comes from the vagus nerve. Very simply, I won't go into much more detail there. Okay, so bronchi. So the bronchi are the continuation from the trachea. So everything after T4 is bronchus. Okay, so the continuation the continuation is up until the level of the bronchioles. So the trachea bifurcates into left and right principal bronchi, which then branch further into lobar bronchi. They're called lobar because they supply, or each lobar bronchus will supply one lobe of the lung, which we'll see in a moment. The right bronchus, this is quite important to note, the right bronchus is shorter. It's not as clear on this scheme, but you can see the right bronchus is shorter than the left bronchus. You can see it's wider. Yeah, it's got a larger diameter, and it's more vertical. In comparison to the left one, which is meant to be longer, it's narrower and it's slightly more horizontal. And the reason is important to know this: if there is sort of aspiration or something is swallowed, not swallowed, goes down the wrong hole, it's more likely to end up going down into the more vertical route, so into the right bronchus, into the right lung. Okay, so let's talk about the position and syncope. So position syncope, left bronchus is located below the arch of the aorta, and another very important scheme in the book is the positioning of the hilum of the lungs. So what's important to note is that there's the organization is different from left to right lung. So you can see from the left lung, the cranial-most structure is the artery, the pulmonary artery. Then we have the bronchus, which is here. And then the caudal-most structures are, again, I guess this is quite inconsistent, but just learn as A, B, and V. V for pulmonary veins. In contrast, we have bronchus, which is generally the most cranially located structure, B. Then we have the pulmonary artery. Then we have the pulmonary veins. So the pulmonary veins are always located at the bottom, but the positioning of the artery comparatively to the bronchus is what changes basically. One thing which I'm not going to talk about in detail, which I think is very self-explanatory, is go over these schemes and look at the left lung, compare the left lung to the right lung, and take note of all of these impressions. These impressions show you what the nearby structures are. So it will really help when you study the position and syncope. So yeah, so this I think it's quite self-explanatory. Okay, so now let's go into the lungs. So lungs, as you know, paired organs for gas exchange between the air and the blood. So we have the alveoli and the alveolar membranes, which are performing this function. In terms of the structures, we have two lungs, like I mentioned. Each lung has either 2 or 3 lobes. So the left lung has 2 lobes, the right lung has 3 lobes. In terms of now a bit more detail now with position and syncope, they occupy the pleural cavities. The apex, you can see here, this is the apex, contains a groove. Actually, there are 2 grooves in the apex. One is for the subclavian artery, one is for the first rib. And then the opposite side, we have the base. And the base, or the diaphragmatic surface, is obviously resting on the diaphragm, as you can see in this image here. The costal surface is the anterolateral surface here, and this is the posterior view, so you can see the posterior surface here and lateral surface. This is what is in contact with the ribs, so costal. And then finally the mediastinal surface, and the medial surface is facing towards this space. This space, which is created, or you can see quite nicely here as well, this space between the lungs is known as the mediastinum. Okay, a bit more detail. We have an anterior margin, which is this, posterior margin posteriorly here. We have an oblique fissure, and we have a horizontal fissure. So this is the horizontal fissure, which we can see divides the right lung. Specifically, it's located between the superior and the middle lobes of the right lung. And you can quite nicely see that the left lung does not have a horizontal fissure. Okay, it just has an oblique fissure. Both lungs have an oblique fissure. This fissure traverses the entire diameter of the lungs here. So this is just viewing from the anterior side, but it goes all the way around. And the oblique fissure divides up superior and inferior lobes of the left lung and divides up middle and inferior lobe of the right lung. Okay, so that's quite important to note. Okay, so now tracheobronchial tree. So this is what the book says. So you can see the divisions as we get progressively smaller and smaller. We go from lobar bronchi into the segments of the lungs, into the terminal bronchi, respiratory bronchi. We're losing structures as we go. So we lose cartilage first, then we lose muscle. We end up in the alveoli, basically, for gas exchange. Okay. Neurovasculature. This is quite important. You guys have already been taught the digestive system. You've been through that system, so you'll know that the liver also has what's called a dual blood supply. So lungs are also one of the organs which have dual blood supply. What this means is that there's a nutritive circulation and a functional circulation. So I've tried to keep consistent with my coloring. So you can see the reddish, orangish color is the arterial blood supply, blue is the venous supply. So what's important to note here? Well, nutritive means the blood is supplying the actual tissue of the organ, or the parenchyma of the organ. So the lung tissue requires this for its metabolic activities. So the arterial blood comes directly from the aorta, from the thoracic aorta, or via the internal thoracic artery. Internal thoracic artery is located on the internal surface of the sternum. Yeah, just laterally runs down the body of the sternum on the internal surface. The veins, so this is the venous drainage, is the bronchial veins. And now functional means this is blood. Obviously, as you know, the function of the lungs is to filter out carbon dioxide and oxygen and exchange it with, well, again, with carbon dioxide and oxygen. So the blood reaches the lungs, oxygen-rich blood reaches the lungs through 4 pulmonary veins. Okay, this is oxygen-rich blood, pulmonary veins. And these come directly from the left atrium. In contrast, the deoxygenated blood, which goes from the lungs, is called the pulmonary arteries. So pulmonary arteries empty into the left atrium. Okay. So yeah, I wanted to just mention very quickly lymph nodes. The reason why is it's important to know the different groups. So this is just kind of a simplification of what's written in the white book. So at the hilum, yeah, the hilum is located here. This is the entry point of the vessels and structures into the lungs. At the hilum, we have a group of lymph nodes called the bronchopulmonary nodes. At the bifurcation, we have the superior and inferior tracheobronchial nodes. Hopefully the naming helps because we know this is the interface between the trachea here and the bronchi, which is the next structured on along. Then we have the left and right paratracheal. So these are quite self-explanatory. We mentioned this before. So either side of the trachea, we have paratracheal lymph nodes. And these will all drain into the venous angles you can see here. So when you study the lymph nodes, the lymph systems, you'll learn about the ducts we have. So these essentially drain into the bronchomediastinal trunks, left and right. And then eventually the lymph finds its way to the venous system. You can see the innervation is exactly the same as before. So sympathetic and parasympathetic. Okay, so almost finished. So I just want to wrap up by talking about the pleura. So the pleura are actually cavities. Well, they can be described. Well, sorry, I'll rephrase. The pleura are these membranes, and the pleural cavities are located inside these membranous sacs. So the lungs are, as you can see from these images, are encased or enclosed in the pleura, and there are two types of pleura. So the pleura, which is firmly adherent to the lungs, so it's firmly attached to the lungs. This is called the visceral pleura. And the parietal pleura is located slightly laterally, and we have the pleural space, which is located between the two pleura, basically. And it's a cavity, like I said before. It contains serous fluid, and its function is to assist in lung movements and to reduce the friction as the lungs expand and deflate, so inflate and deflate during inspiration, expiration. You'll see that the book talks about a few different lines. One thing I forgot to mention. In the previous slide for the lungs, there is a section in the white book which talks about segments and numbering of the different segments of the lungs. You don't need to know that. For the lungs and also the pleura, there are these reflection lines. So an anterior reflection line in the book talks about the kind of connecting these different parts of the lines, and you need to know roughly where the pleural extensions are located, but it's important to just note that the pleural lines are different to the pulmonary lines, these lung lines, these kind of projection points on the anterior thoracic wall or the posterior thoracic wall. So this is just a bit of detail which I haven't included in this lecture, but essentially you just follow the contour of the lungs or follow the contour of the pleura, and this is basically these lines: anterior, inferior, and posterior reflection lines. So anterior is here, posterior is here, and inferior is here. So the parts, so I mentioned before, we have parietal and visceral pleura. There are a few ligaments, and the names of the ligaments should help. So scalenopleural, vertebrapleural, costopleural, and these recesses are sort of spaces which are formed in the pleural cavity. So costodiaphragmatic, costomediastinal, phrenicomediastinal, between the adjacent structures. And you can see the anterior dissection of the thorax here, and you can see the pleura in this white membrane, which is covering the lungs underneath. Okay, so this is a slide with some of my references. So like I said, this will be put on the MIMSA Hub, and you can access the PowerPoint there if you'd like to review any of the slides. And yeah, I apologize for starting a bit late today, and please, if you could fill in this feedback form, this MIMSA form, I'd really appreciate it. I hope you guys enjoyed the lecture. I hope you guys learned something new. Yeah, I will kind of check the chat now if there are any questions. If there are any questions, please feel free to either unmute or you can just type in the chat. I'll just wait for a moment. Thank you, Ashwin, for